Hi everyone, thanks very much for joining us today at this Tech for the Global Goals track, and specifically to this tech session, how ARM technology will help the world to build back smarter post-COVID-19. My name's Fran Baker and I lead social impact and innovation at ARM, where we're looking to marry our business capabilities with our societal responsibilities. And I'm joined today by Christine from Simprints, one of ARM's long-standing social impact partners. COVID-19 has quite clearly highlighted the interconnectivity and fragility of the systems that hold our lives together. And we're forced to reevaluate the way that we live, the way that we work, and the way that we connect with the world around us. Build Back Better is a phrase that was first coined by the UN in a disaster recovery context and has gained momentum globally, with the world looking at ensuring long-term and long-lasting, sustainable and equitable resilience as we rebuild post-COVID. The tech industry has got a huge role to play in this equitable rebuild, and we're asking the question, how can we build back smarter? Through this Tech for the Global Goals track, and specifically this session, we're looking at social innovation at the application level, asking how we as individuals, as engineers, as developers, and as organisations can use this turning point as an opportunity to build a better, fairer economy and society for everyone and ensure that we leave no one behind. And the roadmap or framework with which to do that is the UN Sustainable Development Goals, also known as the Global Goals. In 2015, all 193 member states of the UN agreed to these 17 interconnected goals with the aim to create a better world by 2030, ending poverty, fighting inequality, and urgently addressing the climate crisis. Each goal has a list of targets that sits behind it, and within each target are a set of indicators used to measure progress towards reaching these goals. Out of the 169 targets that sit behind the goals, 70% of them can be directly supported by advanced technologies, which means that the tech sector have a significant role to play in addressing some of the world's biggest challenges. They serve as the world's to-do list. You can't have healthy people on an unhealthy planet, just as you can't have sustainable business in an unsustainable world. And so the best way to make a great future is to invent it ourselves, and those of you attending this session today are in a unique position to do exactly that. In this session, we're looking specifically at digital identity, with the key takeaway that identification matters. How do you prove today that you are who you say you are to the people and institutions that you interact with or who grant you access to services? From opening your first bank account, to proving your eligibility for health insurance, applying for university, or going off on holiday. How do you do that without an ID? Your quality of life and opportunities become severely restricted. An officially recognised ID is a key enabler, critical not just for exercising rights, but also for accessing essential services like healthcare, finance, education. And according to the World Bank Group's latest estimates, this is problematic for an estimated 1.1 billion people around the world without any formal ID. Being able to reliably verify the identities of their populations is critical for countries to deliver services efficiently, and this overwhelmingly and disproportionately impacts the poor, those in low-income countries, and particularly women. And one organisation looking to address this significant problem is Simprints. Christine's here today to deep dive into their tech and share with you the reason why this is needed so badly. Over to you, Christine.
Thanks so much, Fran. And we're super excited to be here. ARM CSR is our oldest CSR partner, and it's not an exaggeration to say that without ARM's support in the early days, we wouldn't be here today to be presenting in front of you. So we're thrilled to be sharing our story, but more importantly, we're thrilled to be sharing an illustration of what technology for good, or tech for good for short, can do to help us achieve the SDGs. So Simprints is a nonprofit tech company in the UK, and we have a very simple mission, and it's to make sure that every intervention, every vaccine, every dollar, every public good reaches the people who need them most. And we do this by building and deploying biometric identification solutions with our partners in some of the most harshest resource places in the world. And so my name is Christine. I'm the head of strategic partnerships, and I'm joined by Siobhan, who's our senior product manager, who is the product manager for our contactless facial recognition modality, which you'll be hearing more about soon. And so Simprints works across multiple sectors in global health and development. We began in maternal, newborn, and child health, or MNCH for short. For those of you who aren't familiar with this sector, the WHO recommends women have 8 visits throughout the duration of their pregnancy. Unfortunately, women in the poorest areas of the world have access to maybe a fraction of that, if even one visit. And this leads to complications. It leads to deaths of mothers and their babies that are preventable, frankly. And so we started with a small project with BRAC, which is the world's largest NGO. They are based in Bangladesh. And we were able to work with them to track care visits of mothers in the slums of Dhaka. We quickly then expanded to a few other sectors that you see on the screen here. So we expanded to cash and voucher assistance, to infectious diseases, to neglected tropical diseases, or NTDs for short. And in cash and voucher assistance, we worked with Mercy Corps and UNICEF to disperse cash aid to internally displaced persons fleeing Boko Haram violence in northern Nigeria. With infectious diseases, we worked with a number of university institutions, actually, in their clinical trials to make sure that people who were receiving HIV treatment were indeed receiving the full course of that care across Malawi and in Zimbabwe as well. And then with neglected tropical diseases, we worked with a few local organizations, small and big ones, you'll hear more about that later, to disperse deworming treatment to children or adults in remote villages to make sure that these parasites that are in the soil are not infecting and reinfecting the population. And so we were able to work with them at a large scale on that. Now we're gearing up to help with the COVID response. Tied to that is the COVID vaccine that is slated to come out sometime in the next year or two. And so we are working in that response sector as well as immunizations, making sure that every vaccine reaches every patient. We've been around for 5 years. And in the 5 years, we've deployed across 12 countries in projects in healthcare, of course, that's where our focus is, but also in finance and in education. And we've reached almost 400,000 beneficiaries across Sub-Saharan Africa and South Asia. Some of our biggest partners are on the screen there in front of you. It's with the Ethiopian Federal Ministry of Health and with BRAC, which I'd mentioned is the world's largest NGO. So a little bit more about the technical stuff then, how our system works. So we optimize and build biometric identification tools. Currently, we have a contact-based fingerprint module and a contactless facial recognition module that is embedded in a wraparound Simprins ID application. We then seamlessly plug into our partner's fuller workflow in order to have that easy, unbroken workflow for the frontline workers that they deploy. So if I were to kind of walk you through a simple journey of how this can work. So our partners typically use, so Mercy Corps, UNICEF, they typically use one of the major data collection platforms in the world, DHIS2, CompCare, OpenSRP. These are basically data collection apps that run on smart devices like smartphones and tablets. They will then deploy a cadre of community health workers who are equipped with a smart device in order to get patients' medical records in a digital fashion on the data collection platform. Now, if they work with Simprints, a part of that digital medical record will be a biometric identifier. And so what happens is a healthcare worker will enroll biometrically a patient using their fingerprint or using their face, and then that biometric identifier is tied to their unique medical record. Then when it's time for follow-up treatment, they'll return to that person, scan that person's face or fingerprint, and we will run the matching algorithm on the back end and give back a number of the top matches, essentially. And the health worker will then select the top match and then proceed with the intervention that she is offering to the patient. So beyond the ID tools, what else do? We don't just wrap tech and throw it over the wall and say, good luck. We work really closely with our partners. And so we have a seamless project setup where we work really closely with their team to make sure that the entire workflow, beyond just the tech, but the entire workflow is easy for the community health workers to use. In many cases, community health workers are actually low literacy. And so this might be the first time they're using technology of this scale. And so we work really closely with them to make it as easy as possible for them to use and as comfortable as possible for them to use. And then finally, we also support with data analytics, with technical maintenance, and also project management. And so while the project is live, Simprints is there every step of the way to make sure the project is a success. So now zeroing in on the biometric modalities. On your right, you will see our flagship product, which is the Vero fingerprint scanner. It's contact-based biometric. We designed this fingerprint scanner to be mobile, to be wireless, to be ergonomic, rugged, and accurate in the low resource areas that it's being deployed in. And as you can see, it's also got a ton of ARM technology inside it as well. And then on your left, you're going to see our newer modality, which is the contactless biometric solution using facial recognition. And we've optimized this to guide the user through a very simple and high quality image capture process straight on the mobile phone's camera, using the mobile phone's camera. And so there's no extra hardware involved. I'm going to run you through a few of our projects that we're most excited about. So there's 3 projects I wanted to highlight for you so you can get a sense of how Simprints works in the field. So the first one I want to talk to you about is the project we have with the Ethiopian Federal Ministry of Health. Now, the Ministry of Health has been spearheading a very ambitious push to digitize their health system. So the project we're involved in is a piece of that. It's called the Electronic Community Health Information System, or ECHIS for short. And as far as we know, it's the first co-created national biometric ID system for health workers, or in Ethiopia, as they're known, health extension workers. Apologies. One of the objectives of the project is to encourage data use for health system strengthening. So the moving image you see in front of you in the middle of the slide, those blue dots, those are people. Every single one of those dots represents an individual. Over time, being biometrically identified in the midst of a rollout of an intervention. We hope that this project is going to be an example for other countries to follow, the ways in which ministries of health and ministries of other services can actually harness available technology available today to be able to increase the health of their populations and increase the well-being of their populations. The second project I want to highlight is one of our first ones, and we're really proud of this one because it's the first time we got evidence base for our impact. So I spoke already about BRAC. We worked with them in a small pilot delivering maternal health care to women in the slums of Dhaka. And so I believe it was around 23,000 women in this small pilot. And in a longitudinal study, we found that in the areas where Simprints was deployed, we had a 38% increase in maternal health visits for mothers. We had an 11% increase in postnatal care visits for newborns. And this was huge for us because it was the first validation of the impact we can have. And so that from here, we've scaled up. We're working with BRAC right now to reach 1 million mothers and newborns. And then finally, another project of ours is improving HIV outcomes in women in Malawi. So we worked with the University of North Carolina, and they also did 2 published studies, which are published in journals focused on AIDS. And of the many findings that they published, one that stuck out to me is that where Simprints was deployed in these HIV clinics, 81% of patients were identified using our system versus the status quo, which was only able to capture 50%. So what this means essentially is that if you are a woman in Malawi trying to have HIV treatment, there's a 50% chance you're just going to fall off the grid halfway through your HIV treatment. Whereas with Simprints, we had 81% captured successfully. And so we were super thrilled to hear about this outcome as well. So the projects that I highlighted, as well as the other projects that we work on, this all funnels up to our near-term dream, which is to help our partners verify their impact at an individual level in real time on the ground. And we've never had this level of clarity before. We've never been able to see to date the impact of an intervention at the individual level, who you're reaching, who you're missing. So this is really exciting that we can do this with technology that we have today. Fran mentioned in the very beginning that over 1 billion people don't have official ID. That's 1 billion people and more, I'd argue, that are not receiving essential life-saving care, which they absolutely can and should. So you see in front of you a map, and this map is of a section of Dhaka slum. Each dot represents a human. In this case, each dot represents a mother receiving her antenatal care visits. And you'll also see on here rings. Some of the rings overlap with the circles, the dots, some of the rings don't. And these rings represent babies that are reached with vaccines. So we're tracking 2 interventions in this case. Imagine if you're a health worker and you're trying to make sure that all the women in your catchment area are receiving all their antenatal care visits and their babies are receiving all the vaccines they're supposed to receive. And you're able to do that by biometrically verifying which women in your area received all 8 visits, antenatal care visits, which women received 4, which women received 1, which newborns received their full course of immunizations, which newborns didn't. And so you're able to see who you're reaching and, more importantly, who's falling through the cracks. And by being able to visualize that at a bigger scale, then you can actually start to see where in your program you can improve to make sure that no one is left behind. So that's our vision, and thank you for listening to this presentation today. We're happy to answer your questions.
Thank you very much, Christine, for taking us through your awesome showcase of Simprints. There's contact details on the screen for you right now, so if you want to get in touch with Simprints, please do. And if you want to find out more about sustainability at ARM and the kinds of things that we're doing for Tech for the Global Goals, you can find this on our website. Now we're open for Q&A all the way through, so we hope we've answered your questions, but otherwise please do get in touch and enjoy the rest of the track.